this audio 的一个分享。
And then we can have the question and answer sessions.
接下来是问题答问时间。
Hello everybody. My name is Alice Au. I was found to have myeloma in 2013. Actually, I didn't expect it because I don't have any symptoms whatsoever. It was during a routine medical checkup. The doctor told me that my cancer is still on the high side. In fact, it was marginally high. So, slightly high that he said actually it's nothing now, but maybe because it might affect my thyroid. Then he asked me to go for further check. Then I went to SGH for checkup, and surprisingly I was told that I have myeloma. Okay, I take it quite well lah. I don't know why at the time I was very brave, and actually until now I don't quite understand myself why I was so calm. Okay, I think one of the things I want to say is that acceptance is very important. Once you accept your condition, you can carry on from there. No point, fighting against it. It will not help at all. So acceptance is the first thing now. Okay, so I went for 6 chemotherapy sessions, and then followed by autologous transplant. Is anybody going for transplant here? Okay. If let's say you have any questions, you can ask me later on. I can share with you my experience. Okay, then Dr. Esmeralda Kyo was my doctor. Then she asked me whether I would like to take part in my clinical trial. I said yes lah. At the time I was not really thinking too much. But come to think of it, of course, when you take part in a clinical trial, there's some risk involved. But then before I took part in the trial, we did ask Dr. Kyo what are the risks, and she did explain to me that actually the drug has been used for some time, quite a number of years. It's very safe. I suppose for new drugs also, the doctors have done something to take certain precautions before they try on human beings. Maybe Dr. Satish can share with us later on what are the precautions being taken. Okay, at the beginning of my treatment, there's a coordinator, Ms. Shilpa. She was there to assist me and help me around. Now she has joined another research, and it's Ms. Chua who is helping me now. And I feel very good about the trial is that she is there to assist me, to go with me for consultation, to do blood tests. I like the feeling very much is that somebody is there to support me, to answer my questions whenever I have doubts. And somebody monitor my progress that I'm actually doing fine and on the right track. And also, as Dr. Satish has mentioned, this drug doesn't come cheap. And for me, I am not that rich lah. And no doubt insurance, I didn't buy the highest one. So I still have to pay for my chemo drugs. So these drugs actually the drug is on my bones to help to strengthen my bone. I think it's really helped to ease my financial load. And also I was given transport allowance to come here. And at the time when I was on my chemo, I was rather weak. And I think coming by taxi is a better option than coming by MRT. One thing I want to highlight to the research team is that I was given X-ray to check my bones every 3 months. I think that's a bit too frequent. Maybe just to feedback to the research team, maybe they cut down once in half a year. Okay. These support groups from the myeloma forum. We have a group that every time we email each other and we come here to share. We feel that we are not alone. That feeling is very, really supports. It's very positive, like Dr. Chua said just now. All those things I've read from the internet, I'm trying myself on all the methods that she shared. Of course, yeah, it works, it really works. especially before you go for transplant, then somebody tell you what to expect, how it's going to happen. It will reduce your fear of the unknown, and you will approach your journey in a much better frame of mind. Okay, during my stay in hospital when I was in intensive care, doing my transplant, I was in block 48 and block 74. There were few nurses, especially I would like to mention, they were especially kind and really went out of the way to help me, to make me feel comfortable. The nurses are Song Siu Kam, Leia, Liao Siu Tin, Sheila, Merly, and Annalisa. Yeah. I would strongly recommend others to participate in clinical trials. It is because of those people who participated in the past. That's why now our survival rate is much higher than before. So we have to carry on the good work. It will benefit our future generation. Some decades ago, if you found you have cancer, you are as good as getting an invitation from heaven. But today, we all know, right, that we have hope. The survival rate is definitely much higher. The journey is not easy, and because it's not easy, I treasure my times now, and I live every day in the moment, every moment. I recommend that you read some inspirational books and articles, maybe 10 minutes a day. Just like you have to eat nutritional food every day, so it's best that you read some inspiration article to keep your spirits high every day. Just 10 minutes a day, but every day. Every day is the important word. Okay, stress and negative emotion will contribute to cancer and many other sicknesses. Try relaxation exercise, and there's another option, meditation. I meditate myself to keep myself calm and peaceful. I think it works. Of course, not everybody knows how to meditate. Maybe you go to the internet and find something that suits you, or otherwise, you just ask around. Maybe Dr. Chua can help. Okay, it certainly helps. Okay, may I extend my best wishes to all of you. Be well. Thank you.